Nearly every machine in a hospital is now outfitted with an alarm, meant to draw attention to changes in a patient's condition and speed caregivers to their bedside. In reality, this means tens of thousands of alarms shriek, beep, and buzz every day in every U.S. hospital. All sound urgent, but few require immediate attention or get it. Research indicates that caregivers can become desensitized to these critical warnings, a condition commonly known as alarm fatigue. But what does that mean for patients? Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hedderly with AHA Communications. Alarm fatigue can take place when the total number of alarms overwhelm clinicians, possibly leading to alarms being disabled, silenced, or overlooked. The need is clear for hospital leaders to prioritize alarm system safety and reduce the number of non-critical alarms to allow care team members to focus on what matters most, caring for patients. Join us now to hear how Eisenhower Health was able to prioritize alarm system safety through effective alarm management strategies. These have led to fewer electronic cries for attention, allowing providers to respond to the alarms that really improved patient care and also improved care team satisfaction. Today's podcast is brought to you by Spacelabs Healthcare.
I'm Marie Clary Fishman. I'm the Vice President of Clinical Quality here with the American Hospital Association and nurse by birth at this point. The American Association of Critical Care Nurses defines alarm fatigue as a sensory overload that occurs when clinicians are exposed to an excessive number of alarms. So we know that nurses and other care team members working in units like the intensive care unit are all too familiar with alarm fatigue. The overwhelming number of alarms from various devices can make it difficult for health providers to focus on what's most critical. It's that overwhelming sound that you hear going on over and over again. If we don't do something with this and address this, the results can include caregivers becoming desensitized to those alarms. And the alarms that are really trying to communicate something to us become background noise, and we don't react when we need to. So with me today, we have two professionals that are going to help us understand this issue. We have Susan Velde. She's a clinical director at Eisenhower Health. And we have Lindsay Kirkendall. She's the director of the U.S. Clinical Solutions at Spacelabs Healthcare. And we're going to talk today about how an effective alarm management strategy can enable prioritization of those critical alarms while eliminating the nuisance alarms, which really gives us the opportunity to manage that issue of alarm fatigue and improve the outcomes of care that we're looking for. So let me get started on this. We know that alarm fatigue is not necessarily a new challenge to healthcare or to clinical providers. But hospitals are beginning to look at this issue differently, and they're looking at alarm management in new ways. Why do you think this is?
I think this is first and foremost, it's patient safety. Patient safety related. Our alarms are there for a reason, and that machinery is telling us something that we need to intervene. And secondly, provider satisfaction. The nurses don't want to sit and listen to alarms all day long.
Yeah, Susan, I totally agree with you. And what's interesting is when I've worked with hospitals across the country and you look at how long we've been talking about alarm management, I think it was maybe 2013 when JCO came out with kind of that first initiative, right? That we need to start looking at alarms. And you think about how technology has changed over the last decade, and yet here we are still talking about it. But I think maybe there's a couple of reasons why. Number one, I think we have more technology than ever, which to me, I don't know how you feel, but makes more alarms in the environment, right? It's supposed to help us, but oftentimes it's creating additional alarms. And especially staff shortages that exist right now. Like you said, it's a nurse dissatisfier for sure. They're being asked to do more with less. And we have to make the environment right for the caregiver and, of course, the patient.
Really important points to pick up on. Where in particular, I know we mentioned the critical care units, but where in particular are you really seeing this increased prioritization take off? And are there particular patient types that you're seeing this in, or particular types of units? And maybe we think of generally the critical care units, but other places that we might be seeing or other types of patients?
Yes, obviously in the critical care, as aforementioned. Also, it's really important for me here in our telemetry unit. I get a vast variety of patients with many different diagnoses. We also have it in our PACU and our special procedures unit, where the patients are there in a much shorter time and we're doing their cardioversions or other types of procedures. I think before the effort and the interest was on the ICU because everyone just expected those patients are a lot sicker. We expect a lot more noise, a lot more confusion. But that has spilled over into these other units, which I don't think everyone was really prepared for.
I definitely agree with you about the ICU. The sickest patients, the most equipment in the room. I mean, you're looking at, ventilators or ECMO or the patient monitor. There's constant noise in those rooms. And when you think about how sick patients are in the ICU and the need to have a healing environment, certainly if there's thousands of alarms going off from different pieces of equipment throughout, just even one day for them, it would be difficult to heal in that environment. And nurses, of course, become desensitized to those alarms. Some of them not actionable, but the risk is then that you miss one that is actionable and something happens. But I think what you said, Susan, that might be interesting. I know that you guys made some changes at Eisenhower in the last couple years, going to a centralized monitoring environment and trying to reduce noise out on the floor. Maybe you could talk about that a little bit because I think that was really impactful for the nurses and the patients.
Thank you, Lindsay. And it really made a difference. So, approximately 3 years ago, we decided to go with a central monitoring station, which is off of the patient care floor. What that did is I basically took two soft positions, a monitor tech and a unit secretary, because they were both doing the same, they were doing the same job, and I split those. So now in my central monitoring unit, that's where my alarms are. It has really reduced the noise in the nursing unit so that the unit secretary can concentrate on her job. And I have a monitor tech that does nothing else but watch that monitor. And it's a second pair of eyes for the nurses. I do have they call it a repeater. So the nurses can still see the patient's rhythm and what's going on. And the monitor tech at the first sign of trouble can call the nurse immediately. And I have seen a reduction in catastrophic events actually just because of that. It's been amazing.
What do you think that's done, Susan, for the nurses on the unit? Like, what has been their reaction to the noise, right? Because a lot of times you'll go out into a telemetry unit and maybe a monitor tech is hearing noise in central monitoring and the nurses are hearing that on the floor and they're trying to concentrate on charting and treating the patient and answering phone calls. What do you think that's done for them and what has their response been out on the unit?
Everyone is much happier. Even physicians that round once or twice a day notice a difference on the floor. And now, when I do have an alarm or when that central monitoring unit does call the nurse and says, hey, this just happened, it is a much higher priority now because they're not desensitized to the constant noise. Hey, this is going on. I need to get there.
That's really amazing. So would you consider that a best practice at this point?
I would. It's in the literature. Again, the more that's what alarm fatigue is all about. You hear this constant noise all the time, and all of a sudden it becomes white noise. It's background noise, and it doesn't really mean anything to them. And studies have shown the more alarms you hear, the less likely or the more time it takes for them to address it, which again, depending on what's going on with the patient, a little time can mean the difference between outcomes. So it really has taken on a new importance for the staff here.
Yeah, and I would think, Lindsay, to your point, the satisfaction for the team and the satisfaction on the patient's perspective would be something that would be significant as well. How about the family members? You know, we've probably all at some point seen that astute family member that figures out how to shut those alarms off. That always worries us just a little bit. But what kind of reaction do you see from families who are part of the unit and trying to help their family member heal and be part of the process? What kind of response have you seen from family?
For what I've seen, the families actually are very grateful. The alarms don't ring in the room per se, but they do flash. And the first thing that families are worried about is their loved one. Oh my gosh, I have this yellow flashing light. I have this red flashing light. Somebody needs to come in here. What's going on? As opposed to a nurse coming in and saying, how are you doing? Does it feel like you're having palpitations? You know, those kinds of things. And the family perceives that the nurses are much more aware and with what's going on with the patient before they even know it.
That's really important. I think having the family really as part of the care team is so important. They're going to be part of the care team right when the patient goes home, most likely, or whatever. And so really engaging them while they're in the hospital in all of these ways seems to be a really important thing for us to do.
Yeah, I agree with you, Marie. I think one of the things that's important that I see is we think about teaching patients and family members about their care when they're going to go home, right? It's really important for them to understand how to change wound dressings or, how to provide feedings, those kinds of things. But as we're educating for patients and families in the hospital, I think to both of your points, educating them on what they can expect from that, patient monitor that's attached to their family member and what an alarm means when they see something and that a nurse will come and check on them. The more education you have and the more knowledge you have, the more power, right? And I think that comforts them to understand what's going on in that patient room.
Yeah, that's really important. And we all know how important rest, good rest and sleep is to recovery, even more these days than ever. And we all can have, I'm sure at some point, experienced that at home. I know, I am married to a physician, and so certainly I had to learn to learn to sleep through those pagers and and learn to ignore them because I knew someone else was taking care of them. But I think it's really important for the patients to be able to get that rest, and certainly having the alarm go off somewhere else has got to help with that in the healing and recovery. Let's talk a little bit about the quality improvement perspective on this and the importance of that, and quality improvement being my background. And so this becomes very interesting to me. How does the technology provide data so that you can make data-driven decisions and you can really look at outcomes over time? Talk a little bit about that in the practice you've seen.
Actually, it's very interesting because there's so much data that we're able to glean from just looking at the changes we've made in our monitoring. One of the things is how many patients we actually monitor. I can tell you we have telemetry monitoring on many more patients than probably actually need to be monitored. Obviously, this is a physician decision, but following the American College of Cardiology guidelines and those kinds of things, we've been able to actually decrease the number of patients we monitor. Again, we don't want to not give patients the proper care that they need. However, sometimes just adding things because we can isn't in the best interest of the patient either. Things like alarms. If I have a patient here for 3 or 5 days and I can go in and I can look at their history, their heart rate has been within normal limits. I haven't had any arrhythmias. I haven't had any alarms. Then I can take that back to the physician and say, hey, do we really need to keep monitoring this patient? Or things like if I have someone who is who's an athlete and who is normally bradycardic. I need to change the parameters so that I'm constantly not getting a low heart rate alarm when this is the patient's normal. Again, making sure those alarm settings are adjusted to that patient's needs. If someone is in a faster heart rate, I may want to set those parameters a little bit higher as to opposed to someone else so that I don't keep getting the high heart rate alarms. The level of alarm, maybe I need a lower tone for a lower alarm notification. For example, if I'm having a low battery on a telebox, I don't need that to be fast and loud. It's a lower priority, a lower alarm, a different tone. And those are all kinds of things that I look at. How many people am I monitoring? What are we monitoring them for? All these reports I can get, and it's very helpful to help take care of the future and helps with my staffing.
That's really good. Lindsay,
Yeah.
Susan said the word the future, and thoughts from your perspective about where this goes, where this can go. What are the possibilities moving, forward in this kind of technology and in this kind of data-driven decision making?
Yeah, I think it's a good question, and Susan made some really good points. I think from my perspective as a vendor, right, hospitals are looking to their vendors from these various pieces of equipment to help them, right? The data is so important. I think as I look through research, right, a lot of the studies that were done in the past use nurses' perceived evaluation of how many alarms are on the unit. And although that's a great metric, it's not necessarily objective, right? And so to be able to take the data from the monitors or from any other piece of equipment and have it be very objective and allow the hospital to, as Susan said, see how many patients they have on monitors, see what time of day they're having the most alarms, see what specific alarms are making the most noise, really allows them to make evidence-based decisions within the organization or a committee to make those changes. And I think vendors' equipment offers some of these features and various reports that maybe the hospital may not know about, right? And Susan talked about having a patient, right, that has a lower heart rate or a higher heart rate. It was interesting. I had an example recently. One of my team members went to a NICU, and one of the largest NICUs in the country, and they were having a lot of issues with babies crying and having immediate heart rate alarms. And really, as soon as the baby soothed themselves or quickly, that alarm went away, but it was noise in the environment. And there's features in monitoring systems, right, that'll allow you to maybe delay that alarm to the caregiver and allow the patient to fix that on their own, so we're not getting these alarms that don't require action. So I think the partnership between hospitals and their vendors and trying to make the best care environment and safe environment is where we're going.
I really love that word you used, partnership. And I think that when we think about these kinds of issues, it really is truly about partnership, right? All around partnership between the patient and their caregiver and the physician and the patient. And, you mentioned the partnership with vendors. I think the other thing that is, interesting is partnership with your quality improvement department or team at your particular organization as well. Because while we might be looking at one particular unit, they might look at all of the units, all of that data across the hospital and look for those patterns or trends where care can be improved or changes can be made that will either hit patient satisfaction or clinician satisfaction or all of those different kinds of outcomes that we always focus on improving in healthcare, so that the care is better for our patients and for their families. So lots of partnership opportunities. And I think that's a great word, and that's a great example to define and to describe what you have, Susan and Lindsay, how you help with those success stories with your partners. Really appreciate both of you sharing your experience and your knowledge around this issue of alarms and alarm fatigue. I think it's really an important area for the field and very important for our clinicians and our patients. So really appreciate your insights today, and thank you again for sharing with our members.
Thank you.
Thank you for having me.
If you'd like to learn more about Spacelabs Healthcare, please visit www.spacelabshealthcare, all one word, .com.